Last year's rollout of COVID-19 vaccines brought hope to a lot of families that the worst of the pandemic would soon be over.
And while cases did slow down, they are rising once again as the more contagious Delta variant spreads.
South Dakota's Department of Health reports 216 people with COVID are currently hospitalized. As those numbers go up, so does the chance of our healthcare workers becoming even more fatigued.
In tonight's Eye on KELOLAND, Lauren Solich takes a look at how healthcare workers have felt throughout the pandemic as they face the unthinkable every day.
When the COVID-19 pandemic arrived in South Dakota, it took a physical, emotional, and mental toll on everyone. But it was healthcare workers who, every day, had to answer questions, hold the hands of patients, and do whatever they could to treat those who came into the ICU.
You give 100% in the room for 12 hours a day. And I think that's just the hardest part. You go home and you question, did you do the right things? Did you make all the right calls? I mean, it's emotionally draining.
Once the vaccines started rolling out in December, a light at the end of that long tunnel began to shine.
I cannot overemphasize how much eagerness, excitement, and frankly joy that we're seeing in our healthcare providers clear across our system. This is the first really big step towards getting past this in our mind.
I think that we have a lot to look forward to in moving forward with getting everybody vaccinated and getting this COVID out of the way so we can move forward with our lives again.
But now, cases are on the rise due to the Delta variant.
It seems to, you catch it easier, comes on a little more quickly, and certainly is a little bit more mean than the previous ones. So, my partners and I have all been saying, I cannot believe we're here again, but here we are. We were hoping this would all go away, and it's just not.
That has led to fatigue among some healthcare workers and an increase in those seeking mental health help.
It's very hard. There was hope that with vaccinations and we could reach kind of a herd immunity and get this thing beat. And now it feels, again, a little bit like there's a little bit of a defeat in that we got to get back into being prepared for the worst and hoping for the best.
And now the numbers are going up. Facilities are getting busier. And it's kind of just a frustration or a disappointment that things aren't managed. And so out of that can come some increased anxiety, some increased irritability, a little bit more short-tempered.
In March of this year, Avera set up a healthcare worker hotline that allows them to call in at any point of the day just to have someone listen.
We probably get anywhere from 6 to 15 calls every week, which may not sound like a huge number, but it's really important to those 6 or 15 people. They've went through a lot of trauma, and it's just created some difficulties for them that oftentimes what they need is just someone to talk to on the phone.
Carla Salem, an integrated health therapist with Sanford Health, says there are ways healthcare workers and anyone really can stay mentally healthy while at home too.
So having a little bit of a rest in between work and home, just even changing your clothes can do that for you. Making sure you're taking care of your basic needs, eating a little bit, making sure water is being intaked, making sure you're exercising or having a little movement, and then sleep. Sleep becomes very important when you're already exhausted.
Taking care of yourself no matter your profession.
A person who feels content and happy and satisfied and forgiving of both themselves and others tend to then generate more they just generate more humanity and more kindness to other people.
I think healthcare workers have been heroes throughout this entire pandemic. I encourage healthcare workers to stay upbeat and positive. I think this is definitely something we will conquer. It's just one day at a time.
With Eye on KELOLAND, I'm Lauren Solich.
And we share additional mental health tips into this story on KELOLAND.com. We've also added resources that are available to anyone struggling with depression, anxiety, or thoughts of suicide.
Well, we certainly appreciate everything they do.
We sure do.